Following an exclusive interview on Tuesday with manager of the virology department at the Eureka Medical Laboratory, Paul Chetty, Nightly News broke the story that several suspected cases of the new COVID-19 strain have been detected in Guyana. This was after Health Minister announced last Wednesday that Guyana does not have the capacity to test for any of the new variants of the virus. Mere days after that announcement from the minister, the Eureka Medical Laboratory issued a press release announcing that it is capable of testing for and detecting new strains of the novel coronavirus, which have been discovered in the United Kingdom, Nigeria, and South Africa. In an effort to gain clarity on what really obtained as it relates to the local testing capacity for the new COVID-19 strains, Nightly News reached out to the medical laboratory for an interview and was told of several suspected cases. On Thursday, however, Minister of Health Dr. Frank Anthony denied the reports from the laboratory which were carried by this newscast. The minister, during Thursday's COVID-19 update, reiterated that the laboratories in Guyana do not have the capacity to test for the new variant, and as such, it is yet to be detected locally.
We have not been able to detect this type of virus in Guyana because we just don't have the capacity to do it. For us to be able to differentiate between variants or mutations that are happening with this virus, it would mean that our laboratories must be able to do genetic analyses, and we don't have that.
He further claimed that as part of an existing arrangement with the Caribbean Public Health Agency, Guyana can send patient samples to undergo genome sequencing, which will determine the presence of the new variant in the country. Manager of the virology department at the Eureka Medical Laboratory, Paul Chetty, had explained to this newscast that while the laboratory's machine cannot definitively confirm whether a person has been infected with the new strain of the virus, there are some indicators of the polymerase chain reaction test that suggest that a number of persons who were recently tested might have been infected with one of the new variants.
There is a characteristic of the test that allows us to presumptively know that the person may be infected with this new variant, because our test is identifying 3 genes for the virus, and based on what we've seen, if one of the genes is absent, it's a good indicator that this person may be infected with this new variant of the virus. But it's not always the case, but based on what they've said, in many instances, it is the case.
Chetty made it pellucid that to conclusively identify cases of the new strains, the patient samples will have to be sequenced. Eureka Medical Laboratory does not currently have the requisite equipment to facilitate such.
That requires a whole different platform. Our platforms are really just PCR to look for the genetic information of the virus, not to see what the entire genomic information is saying. So that's the purpose of sequencing, to look at all of the genes. We're just looking for specific targets associated with that virus.
The suspected cases were identified within the last month. Temika Rodney reporting for the HGP Nightly News.